Okay, great. So yeah, we're here today to learn a bit more about primary care roles across North East London and to help kind of promote them to young people and job seekers across the area. So I'm Julia, I manage the North East London Health and Care Careers Project, and we've got lots of different ambassadors who are able to talk about their role, particularly in primary care. So we're going to hear from someone shortly about their role and what it's like to work in primary care. Then we've also got a few members of our young persons panel here from our careers project. So they help us to advise on what would be good to include in the project and sort of give us some advice and attend monthly meetings with us. So Mustafa, do you want to introduce yourself?
Yes, hi, my name is Mustafa Sira. I go to Ilford County High School and I am currently studying biology, chemistry, physics and PE.
Great, thank you. Hanifa, would you like to introduce yourself?
Yeah, my name is Hanifa and I go to Marlborough UTC and I study English literature, sociology and politics.
But brilliant, thank you for introducing yourselves. Can you introduce yourself?
My name is Nada Isa. I am a nurse associate. I just graduated recently. I work in a GP practice. What else?
That's perfect. That's great. Thank
Thanks.
you. And then is it Tabaya?
Yeah, Taiba.
Taiba.
Hi, my name is Taiba. Taiba Ali. I work at Queensland Medical Centre in Waltham Forest. And I'm a nursing associate.
Perfect, thank you. But brilliant, thank you for introducing yourselves. So I'm going to hand it over to you guys now just to ask the questions that we prepared for the ambassador. So I'm going to start with you, Mustafa. So can you ask the first question, please?
Okay, my question is, what are primary care roles?
Primary care role is a whole variety of people working together, like with doctors, nurses, practice manager, nurse practitioner, nursing associate, HCA, reception staff. In a healthcare centre, there is other PCN staff that are also involved, which are pharmacists, mental health practitioners, health and wellbeing coach, physicians, associates, social prescribers, and physiotherapists.
Perfect. Did you have anything to add to that, Nada? Or that
Well,
good?
yeah, sounds good. She actually included everybody here.
Yeah.
And of course, we work with patient as well. That's number one. This is the main thing. We work for the patient, with the patients, for their health. Yeah.
Great, thank you. And then Hanifa, would you be able to ask the next question?
Tell me what your job is and what it involves.
I can say. Well, my everyday, I work 5 days a week, and my roles is as a nurse associate. We see different types of patients for different reasons. First of all, for example, from blood pressure, simple things, to removing stitches or dealing with infected wounds, for example. We treat small, we start from phlebotomy clinic. We do NHS health check for all the patients who reach the age of 40 without having any long-term conditions. We do diabetic check for the patient who suffer from diabetes, and how we control the diabetes, how can be prevented as well, how you can manage it. We do intramuscular injection, like, and subcutaneous injection. For example, COVID injection, the flu jab injections. Yeah, as I said, we do ECG. We do nurses surgery. As I said, different types of wound, which is kind of, we classified it as a minor, and if this needed for further investigation, we of course refer the patient to the right places. For example, the ulcer clinic, or if the patient suffer from second care, needs second care for ulcer. We do as well health promotion. Yeah, we work in kind of anything. Do you like to add, Taiba?
I think you've covered everything. I think the only thing that's missing is smears. You do smears.
Yes, smear and cytology. Yes, smear. I am under the course to do smear and baby immunization. You've done it, well done. I'm still doing it, yeah. So this is actually the new things, the new clinical skills came up recently, which allow the nurse associate to perform. This is a new. I am under this training. I haven't finished it yet.
I've just recently done it. I'm doing
Well
smears
done.
for children.
Great.
How did
Yeah. Thank you. And then Hanifa, the next one.
How did you get into your job?
I was working within the practice. I started off working as a receptionist 21 years ago. Then I worked my way up to a HCA. I was working as a HCA for a good 14 years. I was looking for a way to do the anything to do in nursing for a few years, but I wasn't finding anything that would allow me to carry on to do this degree and work in the practice as well. And a couple of years before, the CCG suggested this nursing associate role, which came out, and they advertised it at practice managers forum, where my practice manager made me aware of this, and that's how I got in contact with them, and I done my 2 years of a nurse associate at UEL in Stratford.
Nada, did you want to talk about your
Yeah,
journey?
sure. My journey is a little bit totally different. My journey, I have a degree in nutrition and I worked in a nutrition team before, but unfortunately, I didn't find myself in it. I wanted to work with patients who really need my care. I've got the potential aspect of care and the knowledge, and I want to implement it and help the patient how we can prevent diseases to come. So the main aspect is to prevention. How we can, with my degree in nutrition, how can I prevent the disease? Most of the disease in nowadays, fortunately, is preventable, but unfortunately we have got lack of information. This lack of information, as a qualified nutritionist, what can I do to vocalize my voice to help people first? So the first I actually put my aim to work in a GP practice. This is where everybody is welcome. All sort of patient are coming, whether if you're younger, if you're a child, or if you're adult, and so on. Then I started to work as a phlebotomist. Okay, because unfortunately I don't find any market for the nutrition degree to be implemented. So I worked as a phlebotomist, and the doctor saw very potential and skilled person, and she said, that's unfair to be only a phlebotomist. I want you to go even further. And she said, look, you've got all the knowledge, but you're lacking for the clinical skills. And this course came up, and that's really wonderful. It's like I start to have the wings. I can explain myself, and I can to promote health to the patient the way it should be correctly. So working when I do, for example, any clinical consultation where the health, always we need the health and nutrition to be involved. So for example, if I'm doing diabetic check, I will give the right advice for patient according and tailor it to the specific patient, so that nursing give me a great opportunity to help the patient how we can prevent, if not prevent, how we can maintain. If you have the disease, how you can maintain it, how we can make this disease to stop, and of course the clinical skills in terms of wound, what we need to do to reduce this infection, and etc.
Great, thank you. Last question, Mustafa.
What did you study and what qualifications did you need to get into your job?
For me, as another with my background, as I said, I have got previous degree. I didn't want anything, but what I know, they wanted English and math. So if you have got English and math level 2, then all the doors will be open to any student as I said, started as a phlebotomist. My colleague said she started as a receptionist. If you have got English and math, that's it. So anybody who has got the passion, who love working with patients, who love talking to patients, of course, this is the only two requirements that you need.
Great. Did you have anything to add to that?
No, exactly the same. When I started this this course, when I went forward for it, I didn't personally need to do anything myself, but there are other people in my classroom that had to do level 2 English and maths. There wasn't anything else that you would need it, but I was already qualified to get in, so I just went along with it. It's fine.
Great.
In fact, Julia, even my university, they told me now that even if you have got a degree in English, I want you to have something as a level 2 here. So they accepted my math, which is fine, but they told me do the English. And I did English here level 2 as well, and I passed it. Yeah. So this is the two main requirement to enter the nurse associate.
Okay, great.
Level 2 maths.
STEAM. Yeah. Because we need math, you know, to calculate the drugs. You need math in everyday life, you know, and English, of course, you need to write the report for the patient. So you should be aware at least how to put the documentation right.
Okay, great. And then Hanifa, do you want to ask the next one?
What advice do you have for young people interested in primary care and these types of roles?
I would say to someone a young person who wants to go into a medical role of our background, is if they are interested to try and see if they can get some work experience in any of these fields and see how they work along with that. Or there is a lot of information available online that they can have a look at. But actually working day to day in a medical facility, that would give them the overall background of what they want to do in the future, if that's what they want to go down.
I would like to add one thing. If the person has got the desire to work in the medical field, has got the patient, has got desire, have got the
caring and empathy, I think.
Exactly, yeah, that's the caring and empathy for the patient, like to communicate with patient, then just go ahead and apply. Before, you just want to see if you are the right person. You know, sometimes we do have the care, we do have the patience, we do have the desire and all the empathy and sympathy for the patient. The only thing sometimes we discover we're not the right people if we didn't attend, like as you mentioned, Taiba, like a just work experience, 1 day, 2 days, just come and shadow, see, am I the right, I have got all the quality, am I now the right person to do this? I'll go in that field because it's very rewarding. I never regret doing what I'm doing. As I said, I finished grade 6. Bachelor degree, and I went all the way to grade 2, or even I don't know what they call it, grade 1, and I built that back again. I would never regret what I'm doing right now. And you can't imagine the reward I receive from patient when the patient says, "Thank you very much, you saved my life. Thank you, you changed my life." For me, that's the satisfaction.
Great, thank you. And then Mustafa, I know you had some questions you wanted to ask as well. So do you want to just ask your questions?
Okay. My first question is, what is the hardest part of your job?
What's the hardest part of your job, would you say?
I think.
Do you want me to say it?
Yeah, go on.
And then give you time to think. Okay. There's nothing in life something called easy. Even a cup of water, if you want to drink it, you need to hold the cup and then take it toward your mouth. Being a mum of 4 children, juggling between being a mum at home, teaching them, cooking, all this, and then coming back here, switch off and work. Okay, and plus another job I have got, which is student. So I've got 3 roles. A mother of children need to take care of them, to need to educate and teach them and look after them and all the mother's duty. And a second thing here, you need to switch straight away from being a mom to being a professional body, to come here, listening to patients, see what they want, what you can, what's your capacity to help them with. And the third things, you need to find as well time for you to sit down and do your work and study, to have to excel. And the more you learn, the more you bring to the table to the patients. So it's not easy. I struggled being a student. I couldn't even find time to went to study. I couldn't find, so the only thing I had to I went start studying during that time till but because of I'm very keen and I'm very passionate and I know what is going to be the outcome, I made it. And I really had a really good grade. And I don't know if you would really want to know, I've been nominated for the Nurse Student Award for Nursing Times Award for 2021 last year. For the whole UK. I think I was the second for the whole UK.
Well done.
Thank you.
Wow, yeah, amazing.
Thank you very much.
I think getting emotionally invested with patients and trying to switch off when you go home, and that's quite hard.
It's not easy.
Yeah.
It's not easy. I learned that is new. I learned that, yeah. I learned that of being around, you know, Julia, what will happen when you are involved in a nursing associate role? You have to work in a different aspect, a different setting. GP practice, they don't have, we see only minors things. When you go to the care home or the nursing home, you will see a different types of patient. When you go to the A&E, you see a different types of patient. When you go to the post-operation theater, this is different. So, and the way how the more you care for the patient, the more you build up a relationship, that's will going to be affect you emotionally. So we always try, and I remember one of the consultants told me, you're here to keep the soul in. Don't get involved emotionally with the patient, otherwise you will be destroyed and you will be burnt before them. So it is hard. It's not easy because we're all made of souls. We all have got emotionals. But what we need to do is trying to, as you said, Taiba, we need to switch
off, because our job is long-term care, so we get to know patients long-term.
I agree.
Day in, day out. So we see them for years on, year out. So when they are going through a hard time, they're struggling with something.
It's true.
With any disease that are going through, it somehow it affects us as well, and to know when to switch off.
Yes, I agree. I agree. And thank you for highlighting this point.
Yeah.
Thank you.
Right. And then John, ask you next one.
Okay. What do you really enjoy in your role?
When a patient comes in and says, thank you, you've helped me. Thank you, I've changed my life because of you.
Yeah, communication skills with patient, talking to them, they will get to know you.
Get through to them and knowing that they've done something because you've told them and you've said something that's made a difference to their lives. And with my patients, I am bilingual as well, so I speak quite a few languages. So when I get to explain about the disease or prevention of a disease to a patient when they come in to see me, and to explain it to them in their language, and they are understanding, and they are more thankful that now I've understood what you've said to me, and I will go and act upon this. That's the best rewarding part, to know that you've got through to someone. That the patient will do something about it with their lives.
Yeah, it's true. It's the rewarding. This is the part when you make a change in their lives and they are happy. And to be honest, yesterday a patient came. We don't remember the patient, especially if they're coming new, and you give advice. Yesterday I was doing blood test because we have got blood test session from 9 to 1. So and the patient stood by looking at me and he said, "I'm not going to take time from you. But only thing, thank you very much, you changed my life." Suddenly everybody was listening. I was shocked because it's something like unexpected. I said, as he said to me, "You're not going to remember, but I remember every single word you said." I said, "Thank you very much, you made my day today." And I literally, he made my day.
I get that as well.
So it's
That's
a
so
rewarding
nice.
job. It's a rewarding job.
Yeah.
It's a rewarding career as well. Yeah, it is.
Great. Thank
Yeah.
you very much. Thank you for asking those questions today. And thanks to the ambassador for helping us out. It's been really useful to hear about your career. And yeah, we look forward to seeing a bit more about primary care and understanding what's happening across North East London.